Hi, everybody. My name is Kyrone Nebolisa, and I'll be doing this PowerPoint presentation along with Eunice and Vaidya. And our focus for our presentation is on the obesity syndrome. More specifically, we'll do a detailed report from Williamson County, Tennessee. So, our highlight is on the obesity syndrome, and we want to give you an overview on what this entails. So, obesity syndrome is a significant health issue not only in Williamson County, Tennessee, but all over the U.S. But despite its status as one of the wealthiest counties in the state of Tennessee, this area still does deal with obesity. So we want to see how we can help it reduce its incidences with the strengths it has to be able to come up with a solution. Additionally, this report outlines the prevalence of obesity, its health implications, contributing lifestyle factors, economic impact, and then we'll highlight some potential strategies to address the issue. So obesity syndrome is prevalence and impact. So Williamson County, Tennessee, as we stated, while having one of the lower over obesity rates in Tennessee, still faces a noticeable obesity rate. This is concerning given the overall high prevalence of obesity in the state. So when tackling with obesity and looking at its impact, it's multidimensional because with obesity, it can help impact your health and it can lead to other underlying diseases, which we'll highlight later in this presentation. It can lead to reduced lifestyle. It can have economic implications and just have a reduction on the overall quality of life. So it's definitely important for us to deal with this so that people can live healthier lifestyles. So with obesity, if it's not cured or taken care of, it can lead to other various chronic health conditions. Some of the other conditions that can be have with dealing with obesity is heart disease. So patients who are dealing with obesity tend to deal with heart disease, which has an increased risk of other cardiovascular diseases. Patients with dealing with obesity also tend to deal with diabetes, more specifically type 2 diabetes. Additionally, patients dealing with obesity sometimes deal with hypertension as well. So we see elevated blood pressure levels, and these conditions unfortunately can lead to increased mortality rates and decreased quality of life. So it's very important that if you deal with obesity, it can help live overall better quality of life and help reduce the chances of other chronic health conditions. So taking a deep dive into Williamson County, Tennessee, and looking at the community there, as far as life expectancy, the life expectancy in this area is 81.3 years of age compared to 75.8 years on the national average. The percentage of residents with no insurance is 5.8% compared to 11.8 on the national average. And lastly, the smoking rate is at 11.2%, where the national average is at 19%. So although this area, like we said, is one of the wealthy areas from a health standpoint, one of the healthier areas in Tennessee, but also in the world, but still they still deal with this obesity epidemic. So when looking to help battle the obesity in this area, we want to capitalize on some of the strengths of the area. So some of the strengths in Williamson County, Tennessee, is that they have strong partnerships with their local hospitals and health departments. So these partnerships have led with the addition of nutritional educational programs, diabetes prevention programs, and access to registered dietitians. So when looking at obesity and looking at how we can utilize the strengths of this area to help combat this issue, these are some of the programs and partnerships you want to strengthen to be able to help figure out a solution.
Thank you, Kyrone, for the introduction to the obesity syndrome in Williamson County, Tennessee. This is located within the metropolitan corridor that includes Franklin and Smyrna, represents a region of dynamic contrast. Although considered metropolitan, 18.6% of the population resides in low-density rural areas, highlighting the need for equitable distribution of vital conditions. The county boasts many indicators of well-being that exceed both state and national averages, suggesting a strong foundation from which to expand health equity. Physical inactivity in Williamson County is 23%, lower than both the national and Tennessee averages, but still offers room for improvement. Quality of life indicators show marked advantages such as housing affordability, air quality, income inequality, and child care costs all outperform state metrics. It is the wealthiest county in Tennessee with access to transportation, high-paying jobs, and well-funded schools contributing to the quality of life for these individuals. The Food Environment Index score is an impressive 9.1 out of 10 compared to the national average of 7.4, reflecting both strong access to healthy food and low levels of food insecurity. County initiatives supporting breastfeeding help combat childhood obesity by encouraging early nutritional health. Approximately 83% of residents have access to locations for physical activities, such as parks or recreation centers, significantly higher than the state average of 68%. Health outcomes in Williamson County further reinforce its reputation as one of the healthiest places in Tennessee. Some of these are premature death rate is 4,400, low birth rate is 6%, poor physical health days, as stated by the participants surveyed, 3.4 days out of 30 days, and also as stated by the participants regarding self-perceived, poor or fair self-reported health is 12%. These metrics not only outpace state averages, but are superior nationally, positioning the county as a health leader while identifying gaps in equitable access. Despite these successes, disparities remain. The quality of life described above is not uniformly experienced across all demographics, particularly for residents in rural areas or lower income brackets. To close these gaps, strategic interventions are necessary to broaden access to transportation, affordable housing, and income opportunities. A 51 evidence-based strategies plan identified by the county health rankings and roadmaps offer actionable pathways to expand equity in Williamson County. Notable initiatives include the following areas and strategies. Regarding income and child support, provide child care subsidies to aid working or schooling parents, and expand child tax credits to support family income. To also address income and wealth equity, it was suggested to expand the earned income tax credit for low to moderate income families. To promote healthy food access and nutrition strategies suggested included restrictions on child-targeted advertising for unhealthy foods, offer competitive pricing of nutritious food options, acceptance of EBT payments at farmers markets, and implementation of farm-to-school programs. To address sustainable food systems, the proposed actions are community gardens and nutrition, education-based community kitchens, and shared commercial food processing spaces for local producers. To improve food distribution sources, proposed actions included community-supported agriculture, or CSA, and for local food hubs to enhance access to fresh produce. In addition to the proposed actions from the county health rankings, this team proposes the following in regards to encouraging physical activity. Leverage the 10 gyms within the 5.51 miles of the I-65 corridor for community events. Offer one-year gym membership raffles to event attendees. Partner with Taproot Farm to host free equestrian riding lessons and animal care programs to encourage outdoor activities, as well as offer to host school group tours and for rural residents. A windshield survey of rural communities for other physical activity is recommended to ensure inclusion beyond Google Map listings. A successful initiative must be rooted in inclusive engagement. This team proposes a coalition comprising representatives of lived experience, academic expertise, moral wisdom, and professional knowledge. The next slides will provide a LAMP model engagement strategic plan identifying these stakeholders and their associated roles and responsibilities. Community members should reflect diversity in race, age, gender, and geographic residence, and the following demographics should be considered from this specific community as to align appropriate representation of lived experience in this community. 50% are identified as female, 15.4% are over the age of 65, 25.4% are under the age of 18, 82.3% are non-Hispanic white, 23% live with functional disabilities, and 18.6% reside in rural areas. When discussing the lived experience, their roles and responsibilities should be that they share their nuanced experience and offer suggestions that will guide those not familiar with what will help. Have them guide windshield surveys or the sect walks as appropriate geographically. For childhood obesity assessment in Tennessee, recommended experts include the Robert Wood Johnson Foundation, assisted through WIC, Tennessee Public Schools, Chronic Weight Management Task Force as created by the Public Chapter 373, and the Tennessee Advisory Commission on Intergovernmental Relations, or TACIR. For those identified as academic expertise individuals, this team recommends that they have previously assisted with assessment and analysis of childhood obesity for the state of Tennessee. And therefore, they have the knowledge and the data to help share with where they were and where to go. These academic professionals highlight the importance of data and science, which can be implemented in schools. Schools can host events and workshops. Educators can play a key role in promoting participation, sharing information with students, and involving families. When discussing the circle or those who comprise moral wisdom, leaders from various churches in Williamson County should be included, and some are listed, but not an all-inclusive list. They are St. Barbara Coptic Orthodox Church, Nolensville First Baptist Church, and Cross and Crown Church. Civic leaders can include Leadership Franklin, which aims to improve life quality, and Young Leaders Council, founded in 1985 in partnership with Frist Foundation and the United Way. What their roles and responsibility will be to morally guide, facilitate worship and civic seniors as appropriate, hold meetings, information sessions, and events, and encourage more participation from the community. Lastly, guidance from those that we identify as professional expertise should include local pediatricians, gerontologists, general medical practitioners, nutritionists, and health fitness professionals. We aim to propose the community have guidance and conversation with those that are professionals in the health community familiar with obesity and measures to reduce and prevent it within the community. We suggest also that these individuals in this category offer assistance and guidance through fairs and free events like Walk in the Park, Lunch and Learn with nutritionists, Tai Chi sessions, and doggy or pet walks. We propose town hall meetings to share information on obesity and healthy lifestyles, comparing state and national statistics to be shared with this public as they stand. Advertise these meetings widely and provide a questionnaire to understand residents' needs. Focus groups for specific demographics, follow-up advisory boards, and workshops will educate the public on healthy eating and exercise, considering budget and access constraints.
I'm Vaidya Bala, and I'll be talking on the asset mapping and strength analysis of our project. We have explored the local community assets in Williamson County, right from the organizational level with the health departments and other health education centers, to the community led local fitness centers and gymnasium, to provide and develop specific targeted exercise programs for obesity, more at the primary prevention and also secondary prevention. And we would like to engage the non-government agencies like YMCA to develop some pamphlets to encourage the community for physical activity and healthy choice living. The next step, which we believe more important in the diverse community, is explore and exchange cultural strengths and tap into those resources to develop and implement community events, health fairs, and setting up wellness workshops, and then tapping into the local cuisine and food outlets to explore the opportunities to promote healthy eating with diversified food culture. And the next step is to explore the social networks and models and to promote and implement support groups for weight loss, fitness club, and incorporate the digital health solutions in order to promote our project plan. And finally, to explore various schools and educational institutions to address this issue across the board, right from an young age to adult life and to older life, to raise the awareness and importance of healthy living with optimal physical activity and healthy choice in eating. And last but not the least is to seek the infrastructure support from the policymakers, and not to forget the emerging climate change that we face. So to explore a natural environment and educate on safe environment and environmental planning. Moving forward, we looked at the strength analysis with community engagement and explored both active and passive participation with health-related events and programs, and engaged the multiple key stakeholders, in particular the educational institutions like the schools, the universities and colleges, to promote healthy choice in eating and lifestyle, and tapped into the supportive local government network and engaged the policymakers for initiatives that are aimed to improve public health. And the next is to identify the gaps, and our focus is mainly to bridge the gap with regards to equitable access and providing a psychologically and physically safe programs in a more affordable with healthy food options and choices, and promote physical activity and explore the opportunities right across the age with quite a diversified program implementation methods. Next, we looked at the community intervention strategies for wellness programs, and the objective was to reduce obesity rates by promoting healthy eating, optimize physical activity, and implement behavioral changes. And the components of the program we believed most important were nutritional education and partnering with local dietitians and nutritionists, and offer workshops, and in fact to make it more as a fun with cooking classes within the community. Secondly is to promote physical activity programs by collaborating with the local gymnasium and community centers to provide a free or a discounted classes for a defined time period. And thirdly, to implement a behavioral support model to establish a support groups and counseling session for weight management, and also engage trained community health workers to achieve this goal, and set up a school initiative programs across both primary and secondary school, and hold workshops and newsletters for community information dissemination. We applied the LAMP model by engaging the community members who have successfully managed the programs for obesity and share their stories, and then engage the academic expertise to collaborate with the local universities for research and evidence-based interventions, and look at the moral wisdom of involving faith-based organizations to promote healthy living and support in the community, and to involve the professional experts like healthcare providers, dietitians, and fitness experts to come together to provide professional guidance. We have developed a Gantt chart to provide a detailed implementation plan. And we divided that as a 2-month program. So the first 2 months will be exploring the community needs assessment, as we believe that it is a community-driven program, and the stakeholders involved are community health care workers and local organizations, and also to get some appropriate survey tools and data sets to get the initial data from the community. The second 2 months will be focusing on coalition building for a strong stakeholders buy-in, and incorporate the LAMP model, and meeting various facilitators and critical enablers to make this project work, and finally to form a strong foundation and coalition. The next couple of months will be focused on developing the program. That will be to develop and discuss with relevant academic experts and professional experts, and also gather appropriate research-based evidence, and finalize a program, more like a curriculum. And then the next 2 months will be focused on a pilot program, engaging community members and local organizations, and also hiring appropriate venues, trainers, and launch the program as a pilot model. Once the pilot model has been assessed to be successful, a full program implementation will be done around the 9th to 10 months with the stakeholder meeting, and also incorporating marketing material and program coordinators. And finally, at the end of 12 months, evaluate the success of the program and make necessary adjustments and fine-tune it, involving academic experts and professional experts. And also to get appropriate 360-degree feedback from the community by providing them with outcome metrics, both qualitative and quantitative. The qualitative metrics we would like to use are body mass index, participation index, and dietary index, and physical exercise. With regards to the qualitative metrics, we would like to use a perceived health improvement, participation feedback questionnaire, program evaluation feedback, and behavior and life change index. We finally looked at the sustainability and evaluation plan and the strategies for maintaining and scaling the intervention, either upstream or to keep it at the current level. And we explored the options of ongoing funding and securing support through the local government support and partnership, and blending both the private and the public organizations. Secondly, stakeholder engagement with regular communication with the stakeholders through meetings, newsletters, and community events. And the third step is capacity building to train the community health workers and volunteers to sustain and expand the program. And fourthly is the policy advocacy, to act as advocate for policies that support healthy living with improved access to nutritious food and safe space for physical activity. And we believe that the program will have to be more adaptive and sensitive to changes, with a regular review based on feedback and implementation. And finally, we believe that the program will have to be owned by the community, for the community, by the community. We are happy to take any questions from the forum.